I joined right before I turned 18. I was sent to Vietnam and spent an additional 13 months, so a total of 20 months in Vietnam. I didn't feel like I was getting any professional help for my PTSD in the private sector because I don't think they knew what it was, or they didn't know what it was from the military standpoint. So it's hard to talk to someone, especially when they ask you if you've been in the military. It's like, well, you haven't been listening to anything I've been saying, for the last 15 years. I joined law enforcement, the sheriff's department here in Seattle. I just felt like I really didn't have anything to live for, so I thought about, made preparations. What's the best way to do this? And I took my revolver a couple of times and saw what it felt like to stick it in my mouth. I went to American Lake, which is a part of Seattle's VA facility. By the end of the program, we bonded with them. We talked to them because they're very knowledgeable about a veteran's needs and what the veterans are experiencing. So it's almost as good as talking to another veteran. The only place you're going to get help is in the VA. Really received no help from the private sector and tremendous amount of help from the VA. In my opinion, if the government wants to shut down the VA or privatize it or give us vouchers, I'm very alarmed about that. I think it'll create problems for all of us, being that we're not going to be dealing with people that know who we are if we go away from the VA. The VA specializes in helping veterans. Private health care does not.
The Veterans Healthcare Policy Institute is a nonpartisan, nonprofit research organization that works to improve the quality and delivery of healthcare to our nation's veterans. Learn more at veteranspolicy.org.